That's the sound of the coffee pouring. Welcome to the Doctor's Brew. I'm your host, Dr. Abdulaziz Al Khayyat.
I'm your co-host, Dr. Bassam Al Mullah. It's nice to see you, Aziz. How are you doing?
It's been a minute. It's been a minute.
Yeah, not for the viewers.
Oh yeah, not for. Well, no. We've been quiet in Ramadan.
Yeah, I hope everyone had a blessed month.
Yes.
And happy Eid to everyone.
Yeah. Happy Eid to everyone, and I think I can speak for all of us when I say that I'm very excited to get back on the coffee routine.
Oh, coffee in the morning. We missed that, didn't we?
Mm-hmm. Yeah, the headaches while rounding, huh?
Yeah, definitely. But I think coffee at night is a different vibe. It's nice. It's been nice this month.
I think that's called insomnia.
Yeah, everyone's sleep schedule, I think, flipped. And
Everyone's going to be late soon, this first week back. So yeah, we are filming on the first day of Eid. And today, I'm drinking just black coffee.
I think you made me this coffee, so I'm drinking the same. Let me taste test.
No special shout out today. This is just coffee in house.
Yeah, we need better coffee.
We need better.
You're not it.
I don't have my gear with me here. What do you want me to do?
Khas, make it happen.
Demands. This is the problem when you have a co-host, guys.
Yeah, I'm needy.
What are we going to get into today, Bassam?
You tell me.
Today, I think it's a bit controversial. But I think we should talk about whether people actually respect doctors.
Okay. So what do you think?
Okay, so full disclosure. There's no absolute. We were talking about this before recording this episode. There's no such thing as 100% of people, 100% respect, don't respect. There's no 100%. But we're discussing our experience and what we've seen from the public, from people working over the past 2 years since graduation.
Yeah, 2 years now.
Yeah.
I think it's a mixed response. I think that, as you said, we don't feel no person falls on either end of the spectrum. I think it's somewhere in between, and I think it depends on the personal experience of the people or patient. Depends on what we're talking about. We talk about patients or their families or just the general view of the public of doctors here in Kuwait. Different responses from different people, I think.
Well, I think you and me also have a unique experience in that we are working after the pandemic. So the pandemic marked on an intellectual and global level a new view on healthcare, whether that be good or bad.
You think people lost their faith in doctors after the pandemic?
I think both things happened simultaneously. I think some people were marveled at how the pandemic, like for example, how the world was able to band together real quick and put out a vaccine, how we were able to, like healthcare workers, how despite putting their lives at risk, they're still out there, people coming out of retirement. So I think there was a lot of respect and love from people. But at the same time, let's not forget all the conspiracy theories, the 5G stuff, all the fear mongering. Some of it justified, some of it not justified. You know, to be fair, it was a very turbulent time. But I think this shifted the public's perspective on doctors. And I'd say on average, my feeling is that people are more dubious of what we suggest.
I think it's a good and bad thing. I think it's important for people to be skeptical, but at the same time, not to the point where they lose complete faith in the system. And I think when it comes down to it, people rely on the system. If someone's sick, they need to go to hospital, and there's nothing that they can do about it. They have to go at the end of the day.
That reminds me, actually, I was working with a really amazing resident in Miami during my observership there. And he told me something so profound. It really stuck with me. He said, people complain about the system. People complain about, oh, the hospital or this is this way or the system is that way. And their complaints are 100% valid, right? And we as doctors, we also complain about the system. Oh, this is this way, that is that way. But he says, but you know what? It's there and it does something. And you want to complain from here to tomorrow, fine. But if there was nothing, imagine what would be going down.
Yeah, it would be back in the like medieval times.
Even before that, you know? we'd be walking around in the, in the medieval times when they had those.
The witch doctor, yeah, the guy with the beak.
So for you guys, just for your information, they had these beaks like back in the bubonic plague times, and they would put like incense and spices and stuff inside, so that way they can like fend off the disease. I think that's why.
I have no idea why. I can't remember why they put those beaks. I think it was just scary for people to look at. Like, oh, if this guy's seeing me, if this guy is coming to visit me, that means I'm dying or I'm gonna be dead.
Well, I know that they would fill that. Those beaks were all filled with herbs
But
and spices.
back then, seeing a doctor was not a good thing.
No,
It was seen as like
A
a
death
bad
sentence.
thing. Yeah,
Yeah.
exactly, a death sentence. Nowadays, it's the other way around. I feel like people see the doctor as a chance of survival or hope. That's the beacon we resemble, I feel.
Well, I mean, I'll be honest. I thought coming into the career that, naively, I thought people would be seeing the doctor as, oh my God, the doctor, kind of like the source of truth and honesty and help, right? But I would say, on average, I'm met with more pushback than acceptance. Do I think people... Okay, here's if I had to sum it all down. I feel like outside of the hospital, people love that I'm a doctor. When I'm out and about and I'm like, I'm a doctor, I do this. Oh my God, يعطيك العافية. Wow,
Yeah.
that's so great. That must be something, wow. But then in the hospital, they're like trying to fight me a lot of times.
Yeah, but I feel like they do that because it's them or their family that are sick, and they're concerned.
It's projection, They also, a lot of them have had a bad experience with a previous doctor, which I think everybody can say that they've had a bad experience with a doctor, regardless. And then they project that onto you because they're trying to protect themselves.
I agree, yeah. And that's personal. That varies person to person. Some people might have had no experience with hospitals or doctors at all, and this is their first time, so they don't know what to expect and they're scared. Other people have had a lot of experience, especially the elderly or chronic patients with chronic illnesses. They have had a lot of exposure to a lot of doctors, and some of them might be good, some of them might be bad. They'll have different experiences, and
But how do we still maintain the relationship, and how do we not get affected? Because there's some days where I feel like my patients really love me, that they really respect me, that we have a good, what is it called, the rapport. We have a good rapport, and I come home happy. And then there's some days where I feel like, regardless of what I say, the patients don't care, their families don't care, they don't want to listen, and they're putting their lives in jeopardy, and I can see it, but I can't do anything. So how do we mediate those things?
I feel like this is something we think about, me and you, as junior doctors, because we haven't had as much experience. I feel like older or more senior doctors, they've had these two types of patients that you've described, both the patients that you had good rapport with and the patients that you had bad rapport with. And they've developed, let's say, endurance to both kinds of patients. And I feel like regardless of which kind of patient, they will deal with the patient the same type of way, and whatever response they get is the response they get. They just try to not take it home with them, I think.
That's an interesting take.
I feel like that's what I would want to do. That's a skill I would want to acquire slowly with time, is to basically do my best with everyone, regardless of how they act with me, as long as I am not endangering a patient's health in any way or being rude in any way.
Yeah.
As long as it's a good rapport that I'm trying to establish with everyone, whatever response I get is the response I get. I'm trying to make it, try to not let it affect me as much as possible.
Let's take it another step further. Do you think that the sort of trust that patients have, and let's call it respect even, that patients have towards their doctor, do you think that it differs by specialty?
I think it's not just specialty. I think there's definitely specialty, maybe, depends on the specialty. To be honest, I don't know.
Like how?
I was thinking of more about how the treatment goes, not the specialty.
Okay.
I was thinking of, let's say, it's two patients who have the exact same problem.
Okay.
And then this doctor gives them the exact same treatment. It works for one, it doesn't work for the other. The second visit or the second time the doctor comes in, or the patient comes to see the doctor, their response will be very different if it was positive versus negative, and depends on the personality of the patient or and their families as well. If it's positive, you might feel like they appreciate, they respect you more, even though you did the exact same thing. And we all know in medicine, not everyone will work with the exact same treatment.
Correct. Absolutely. Well, then that then ties into another question. That then goes into what about if it's chronic versus acute treatments? So I would argue that a lot of the more acute, short-term kind of specialties, there may be a better patient-client, like a patient-doctor relationship. Because, like you said, there's that instant gratification. So you go into the ER, right? You have, I don't know, a cut. You go in, it gets sewed up, you get antibiotics. Okay, I had this problem, it is now solved, I can leave, I trust this, right? But for example, in psychiatry, I do feel like a lot of times our medications are not 100%. They come with their own disadvantages. People need to try different modalities. It's biopsychosocial approach. It's a bit more nuanced than the other more straightforward, pathologies or cases. So with that, there may be a bit more of the, oh, doctor, I've tried everything, nothing works for me, versus if you compare it to like emergency care. But what about surgery? Like, what's been your take?
I think, let's say for me, for orthopedics, I think it's very similar to psychiatry, because a lot of people think that, okay, oh, I broke my bone or I hurt this joint, and then you go in for surgery, you get it fixed, and then you go home. But it's not really that simple. There's a long rehab after that. There's a lot of physiotherapy, a lot of time spent in a cast, and it's as much the patient's duty to follow up on this injury and to make sure that they're recovering well, not just with us, the surgeons, but also with the physiotherapist, with sometimes occupational therapy, and getting back into whatever their previous level of physical activity was, whether that's like just regular, normal activity, or elite level like sports, athletes, things like that.
Well,
a lot of people get frustrated that, let's say, after surgery, oh, I still have so much pain, let's say in my knee or my ankle, and but that's a part of reality of breaking a bone. It's not gonna be fixed the next day. It takes a lot of time, and some people understand this point and are more patient with it. Other people are still, their expectations haven't been met. I think they've had unrealistic expectations, and they expect to have the problem solved within a few days after surgery.
And that's part of our responsibility, to set their expectations.
Yes.
So that way, after they're getting their treatment for whatever condition, they're not turning around and saying, huh? Why is this not 100% back to normal or even better than normal?
Yeah.
You know? Yeah, interesting. Now, let's take this another step further. Have you encountered any situations whereby straight up the relationship turned into disrespect? Where
all the time. Yeah.
Let me finish the question. I was so excited. Okay, yalla, go for it. Explain, justify yourself.
All the
Go
time.
on.
I feel like I've seen personally a lot of times where patients are either rude, angry, screaming, sometimes physically violent. I've seen that happen, where they're physically violent, where they
you gotta tell me this. Come
on. where they'd either like put their hands on the doctor.
No, you never told me this.
I've seen that happen a couple of times.
Okay, tell me.
Yeah, I'll not specify.
No, don't give
which
specific.
Which
no,
hospital
no.
or where, but like a lot of patients, or their families. Their families are usually it's not the patient themselves, it's the family. I've had an encounter with a very angry father who was not, who basically wanted. We were in the outpatient clinic, and in orthopedics we have a lot of patients in the outpatient clinic. A lot of patients that come visit, follow up, and the patient's father wanted to get in to the door, but there was at least 20-30 patients in front of him. So they were standing outside the door, angry, trying to, and they were also cussing. They were saying bad words. They were trying to get in the door. They were disrespecting other patients and their families that were waiting as well.
Yeah.
I feel like these are very isolated situations that happen, but I've encountered this.
Not as isolated as you'd hope. I'll be honest.
Yeah, but they're not as common. They're not as common, thankfully. I hope so. I mean,
Okay,
yeah.
agree to
and
disagree, but sure. All right, all right.
So the doctors, I was in the room. The doctors have noticed this behavior, and they said that you need to stop doing this. You need to go outside and wait with the other patients. The patient refused, and then there was an raising voices, some cussing, and then it turned into physical altercation that had to be stopped. And then the patient had to the patient's father had to be escorted by security outside, and they
Really?
were like, we're not gonna see your son because of this. Yeah,
Really, that's wow.
it happens sometimes.
I mean, recently for me, one thing that stuck with me was that there was a patient's relative who was getting angry about angry at a member of the nursing staff next to me because he wanted someone to see them, and I don't know the details, but they were having their handover meeting, right? And he started yelling and going over the top, and I felt bad. It wasn't towards me, but I stepped out. I tried to diffuse by explaining, sorry, just they're having a meeting. This is why this is, taking this much time. And he started getting even more angry at me, And in a lot of these moments, what I wonder is, why are we so alone? You know what I mean? It's kind of frustrating sometimes when, if you go, for example, to, I don't know, like a shop, right? And you have any customer care concerns, you speak to the manager or this or that. But a lot of times I feel like in healthcare, you have to be the beginning and end. You have to be the HR representative and the actual salesman and
Yeah, there's a lot of being a doctor that's actually has nothing to do with medicine.
Yeah.
It's you're doing a lot of administrative stuff, a lot of moving the patient around like a porter, lots of stuff that's.
Oh yeah, that's actually a good point.
Yeah, there's a lot of things that, and then them contacting you out of hours, sometimes things like that.
I think also just a reminder for all of those healthcare workers out there, you're human beings too. We're human beings. It's normal to also feel angry and sad and disappointed with people, with the world, with the system. I mean, I want to say that I hear you because there's a lot of times I feel that way. But whether we like it or not, it's also our responsibility to take that and then turn it into something good on how to improve the system, how to improve our relationships with our patients, and how to, like you said, compartmentalize and not take that home.
Yeah, I think that's a skill that you get and you learn with time.
Yeah.
I feel like that's an important skill for us junior doctors. A lot of us try to chase the academic part of it, which is still very important,
Yeah.
but at the same time, the psychological aspect of it and trying to adapt yourself and your personality to all walks of life, because that's something you're going to deal with more than majority of people.
Yeah, and also just a reminder for anyone out there, including healthcare workers, because we sit and complain about patients are blah, 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 blah. But then when we're the patient, we do the exact same thing. By the way,
Yeah.
It's not like
fear
we're immune.
strikes and then you act the same way.
Yeah. So just a reminder to everyone also that we need to approach everything with a degree of respect.
And empathy.
And empathy. I like that. It's true. Because we're always dealing with people on some of their worst days. I don't even like going to the doctor. Come on.
Yeah, no one likes it, and then when you do go, you're always worrying. You're like, what's gonna happen? What am I gonna do? It's not. So you have to, as healthcare professionals, we have to keep that into account that these people are seeing us in their most distressed times.
Yeah, but let's go back to the original question. Imagine you have a kid in front of you and he's saying, "Oh, I want to be a doctor because everyone will respect me, right? And people are gonna respect me. Everyone's gonna respect me." What do you think? Then I'll tell you what I think.
I think that going for the medical field just because of respect it's not something to go for.
Yeah, that's a good point.
Because you might not get that, and it's not, you don't want to do 6, 7, 8 years, I don't know how many X amount of years of your life just to get respect. That's not a thing to aim for.
Yeah, I would say that, if someone were to ask me, I'd say that in terms of respect, I think there's a very big difference between respect and impressed. And I think we often get those things confused.
Okay.
I think people get very impressed by the fact that we're doctors, and that's just because we've done a very difficult degree objectively. There's no arguing that medicine is not difficult, right? So I think people are impressed. In terms of respect, respect is so based off of people's experiences with the profession, and more importantly, with you. So the respect will always remain earned.
Yeah.
So
And I think
it
that
doesn't-
applies to everyone, not just doctors. I feel like that
Yeah.
applies
True.
to anyone you
True.
meet in life. Respect is earned, and it depends on how you interact with the people you're talking about with.
Yeah. Well, I think, that's, we're getting close to time here. So let's wrap things up by talking a little bit about our question. And there is one question that keeps popping up for
Yeah.
us, which is, what is going on April 20th?
Yeah, okay. Aziz, you want to tell us what's
Yeah.
happening on April 20th?
So April 20th, we are collaborating. Actually, we're supporting and collaborating. Yeah, we are getting bogged down in terminology here with WIN Academy, which is a medical education group that is hosting an event at the Scientific Center on April 20th. And it's supposed to be like a careers day for high school kids, which I'm very excited for.
Yes, and we are going to be representing the doctors part of it. We're going to have a booth there, and all high school students or anyone interested in going into medicine and are curious and have questions about the career itself, about the studying, the university aspect of it as well. We are going to be here or there in Scientific Center. What, do you remember what time it was? I think it was an all-day thing. It was an all-day thing from 9 to 9. something like
You're
that.
putting me on blast here.
But it's going to be on April 20th at the Scientific Center. So if you know anyone or if you are yourself interested in this career, then me and Aziz are going to be there and other doctors as well to answer all your questions.
Yep. And just to also remind, it's also all healthcare professions as well. So there's
Yes.
pharmacy, for example. I believe physiotherapy as well.
Dentistry, occupational therapy, I think even veterinary school,
Yeah.
lots of careers relating to the science
Yeah.
aspect of it.
And it's really great because, we don't all have that cousin in our family who's gone to do medicine or is currently in med school that we can ask questions from. Sometimes we just need to ask around. And this is really giving an opportunity for people to seek out people who have done their careers and just ask whatever questions in an informal way and engage in a lot of awesome activities. I don't want to spoil the surprise, but a lot of cool stuff is happening.
Yeah, definitely. I was going to hint at the surprise of what's happening, but it's okay. If you don't want to tell them, we can keep it a surprise.
No, go for it.
We can
Go
tell
for
them?
it. Because I don't even know exactly the details, but we're going to do the training for it on Saturday.
Yeah,
go
so
for it.
we're going to have a VR set there provided by WIN Academy and a company that's supplying the VR set. And we're going to be running a simulation of an emergency setting where you can join us and try it out for yourself and see what it's like to be put in that real life situation in a VR setting.
That's really cool for me. So I'm really excited for that, and we're gonna get the training on that soon. So that's gonna be hype.
Yeah, I'm excited to see that. And we hopefully will see you guys there on the 20th of April, and we'll catch you here on the next episode.
Yeah, till next time. So that's the last sip of coffee for the day. Thank you to my co-host, and see you next time.
Bye bye.
Hope you all enjoyed this episode of The Doctor's Brew. New episodes to listen to with a cup of coffee coming your way every Sunday on YouTube and Spotify. And be sure to follow us on Instagram for all the latest updates. See you next time.